Ever wondered why some people can't just snap out of it? Why do some individuals seem trapped in a constant cycle of sadness or worry? It's because they may be battling depression or anxiety, two of the most common mental health disorders. Depression and anxiety, contrary to popular belief, are not just fleeting emotions or states of mind. They are persistent, often debilitating conditions that can drastically impact an individual's life. They are not mere feelings of sadness after a bad day or worry over an upcoming event. These are far deeper, far more complex, and far more serious. Depression, characterized by overwhelming feelings of sadness, hopelessness, and a loss of interest or pleasure in activities, is more than just a temporary bout of the blues. It's a constant companion that can make even the simplest tasks seem insurmountable. The brightest days seem dull and gray. It's a lingering gloom that doesn't fade with time or dissipate with a change of scenery. It's a mental health disorder that affects how you think, feel, and function in daily life. On the other hand, anxiety is more than just the butterflies you feel before a big presentation or the nervous anticipation of a first date. It's a constant state of worry, fear, or unease that doesn't go away and can interfere with your daily activities. It's like a storm that's always brewing, a shadow that's always lurking, a tension that's always mounting. It's important to understand that these are not mere moods or phases. They're not something one can simply get over or snap out of. They're serious, often crippling conditions that can affect every aspect of a person's life. They can disrupt sleep, appetite, work, relationships, and even physical health. Depression and anxiety are not signs of weakness or a lack of willpower. They're not conditions that one chooses to have, and they're not conditions that one should be blamed or shamed for. Like any other medical condition, they require understanding, empathy, and appropriate treatment. Depression and anxiety are not mere moods or phases, they're serious conditions that affect millions worldwide. So what causes someone to develop depression or anxiety? Let's delve into the factors that can contribute to the development of these conditions. Remember, there's no single cause for depression or anxiety. They're complex conditions that result from an interplay of various elements. Firstly, let's talk about genetics. If you have a family history of depression or anxiety, you might be more susceptible to these conditions. The genes we inherit from our parents can influence how our brain processes certain chemicals that control mood or stress. But keep in mind, having a genetic predisposition doesn't guarantee you'll experience depression or anxiety. It just means the likelihood may be higher. Next, environmental factors. This can encompass a wide range of situations, including traumatic events, prolonged stress, or significant life changes. Things like losing a job, the death of a loved one, or even moving to a new city can contribute to feelings of anxiety or depression. These events can trigger or exacerbate these conditions in people who are already vulnerable. Lastly, personal life circumstances play a significant role. Factors such as chronic illness, isolation, or a lack of social support can all contribute to the development of depression and anxiety. Even our personal habits, like poor sleep or lack of physical activity, can influence our mental health. But it's crucial to remember that these factors don't work in isolation. Often, it's a combination of many factors that leads to the onset of these conditions. For example, you might have a genetic predisposition, but it might take a significant stressful event to trigger the onset of depression or anxiety. So it's not a simple cause and effect scenario, and it's definitely not a one-size-fits-all situation. Each person's experience with depression or anxiety is unique, shaped by a complex mix of factors. And just as these conditions can affect anyone, they can also manifest in a multitude of ways. Depression and anxiety do not discriminate. They can affect anyone at any time. How does one know if they're suffering from depression or anxiety? It's a question many people grapple with. Understanding the symptoms is crucial, as these disorders go beyond the realm of normal sadness or worry. Depression is characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It can also lead to physical symptoms, such as changes in appetite and sleep patterns, fatigue, and difficulty concentrating. It's not just a bad day or feeling blue, it's a constant struggle that can last for weeks, months, or even years. Anxiety, on the other hand, is more than just typical worry or fear. It's a persistent and excessive worry about everyday situations. Symptoms can include restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. In severe cases, it can lead to panic attacks, which are sudden periods of intense fear that may include palpitations, pounding heart, or accelerated heart rate, sweating, trembling or shaking, and feelings of shortness of breath, smothering, or choking. Diagnosing these conditions isn't as straightforward as a physical examination or a blood test. It requires a comprehensive evaluation by a mental health professional. They'll ask about your symptoms, how long you've been experiencing them, and how they're impacting your life. They may also use psychological self-assessment tests. The process may seem daunting, but it's essential. It's the first step towards understanding what you're going through and, most importantly, getting the help you need. It's also important to remember that these conditions are common. You're not alone. Millions of people worldwide are going through the same struggle, and many have found ways to manage and overcome their symptoms. So if you're experiencing these symptoms, don't dismiss them as just a phase or something you can snap out of. Reach out to a mental health professional. They're there to help, to listen, and to guide you towards the right treatment. Recognizing the symptoms is the first step towards getting help. So take that step. It's a sign of strength, not weakness, to seek help when you need it. Depression and anxiety are serious, but the good news is they're also treatable. Let's dive into the various treatment options for these conditions. It's important to note that there isn't a one-size-fits-all solution. Treatment needs to be tailored to the individual because everyone's experience with depression and anxiety is different. Therapy is often the first line of defense. Cognitive behavioral therapy, or CBT, is a common form of treatment that helps individuals understand and change thought patterns leading to harmful behaviors or distressing feelings. Another type is interpersonal therapy, which focuses on improving communication and relationship skills. Then there's medication, which can be used in conjunction with therapy. Selective serotonin reuptake inhibitors, or SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs, are often first-line medications. There are also other types, like benzodiazepines, which are typically used for short-term relief of acute symptoms. Next, we have lifestyle changes. This can include regular physical activity, which can boost your mood and act as a natural antidepressant. A balanced diet and adequate sleep can also have a significant impact on your mood and energy levels. Additionally, mindfulness techniques such as meditation and yoga can help cultivate a greater sense of well-being. Beyond these, there are alternative treatments like transcranial magnetic stimulation, or TMS, and electroconvulsive therapy, or ECT. These are generally considered when other treatments haven't been effective. It's also worth mentioning the growing body of research into the potential therapeutic effects of psychedelic substances, such as psilocybin mushrooms and MDMA. Remember, it's crucial to work closely with a healthcare provider or mental health professional to find the right treatment plan. It may take some trial and error, but don't be discouraged. Be patient with yourself and the process. Treatment for depression and anxiety isn't about curing the condition, but managing it in a way that allows you to lead a fulfilling life. It's about finding your balance, regaining control, and embracing the journey of healing and self-discovery. With the right help, it is entirely possible to manage these conditions and lead a fulfilling life. Why is it important to talk about depression and anxiety? The answer is simple, yet profound. It's because there's a stigma attached to mental health conditions, a cloud of misunderstanding that casts a long, dark shadow over those affected. This stigma often leaves people feeling isolated, misunderstood, or even blamed for their condition. It can make the journey to recovery longer and more painful than it needs to be. Let's peel back the layers of this stigma, shall we? At its core, stigma is born from ignorance, a lack of understanding about what depression and anxiety truly are. Many people mistake these conditions for mere mood swings or phases, dismissing them as something one can simply snap out of. But we know that's not the case. Depression and anxiety are serious mental health conditions that require understanding, empathy, and professional help. Stigma doesn't just affect the way others view mental health, it also influences how those suffering from these conditions view themselves. It can create feelings of guilt and shame, making it difficult for individuals to seek help. It can make them feel like they're alone in their struggle, even when help is just a conversation away. But here's the good news. We can change this narrative. And that's where advocacy comes in. Advocacy is about standing up for those who might not be able to stand up for themselves. It's about challenging misconceptions, spreading awareness, and fostering understanding. It's about creating an environment where mental health is seen not as a personal failing, but as a part of the human condition. Every time we openly discuss mental health, we chip away at the stigma. Every time we share our stories, we help others feel less alone. Every time we listen with empathy, we make it easier for someone to reach out for help. And that's just it. Advocacy isn't just about big gestures and grand declarations. It's about the small, everyday acts of kindness and understanding that can make a world of difference. Speaking up about mental health helps break the stigma and makes it easier for those suffering to seek help. And that's why it's important to talk about depression and anxiety.